Hi, I'm Dr. Dawson. Today I want us to talk a little bit about ear pain when it's not an ear infection. I made another video where we talked about your run-of-the-mill ear infections where we get a little cold and then 2 or 3 days into it from the collection of fluid, we get a secondary bacterial infection growing in there, and then we're running more fever and we look sicker, and that's your routine otitis media. But today I want to talk about when it's not that, what kind of things cause us to have ear pain. So the first thing on the list would be an outer ear infection or otitis externa, more commonly referred to as swimmer's ear. So go back to the picture I made for you in the other video, and to remind you, this is your outer ear, this is the outer ear canal, the eardrum, this is the eustachian tube, this is your nose, and this is the middle portion of your ear. So in the outer canal that we're dealing with swimmer's ear, is normally pretty resilient. It's nice, it's smooth, it's well waxed, and it doesn't really get into trouble. But sometimes you'll get some water sitting in here, and that drop of water, when it sits in there, well, the skin underneath it kind of starts getting a little pruny. And when we get that kind of pruny skin, well, then things can get down in there and they kind of start to cause a little infection. And then that can make this whole area red and inflamed and hurt. And this outer portion of your ear is made out of cartilage. And so all this cartilage is connected to this outer portion of your ear. And so when you tug on this part of your ear, it moves that infected cartilage and it makes it hurt. So normally if you touch the outer part of your ear and it hurts, that's an outer ear infection or a swimmer's ear, which is an infection of the ear canal, and not a middle ear infection. This middle ear is surrounded by bone, and that bone doesn't move when you pull in the outer part of your ear. So normal middle ear infections or routine earaches don't cause any pain when you touch the outside portion of your ear. So this is a swimmer's ear. We can put in medicated drops that will clear it up. Certainly also helps to keep the ear dry for about 5 days. So this can totally get cleared up. So that's the first thing that will cause it, otitis externa or swimmer's ear. The second most common thing is similar to what causes ear infections, but is just a chronic pulling back of your eardrum. We talked before about when your eardrum is stretched, that's the main thing that causes pain. It doesn't like to be stretched. So to explain here, this, remember, was our eardrum, our eustachian tube, and our nose. We talked about how our eustachian tube lets air get from the back of your nose to behind your eardrum to keep the pressures the same so the eardrum can flutter. That works fine. But if this eustachian tube gets swollen, air can't get through there. I talked about that if you swallow, you can hear your ear pop as the air goes through there. When it's swollen, ears don't pop. Air can't get through there. We talked about how the lining of the middle ear is similar to lung lining in it absorbs the oxygen. When it does absorb the oxygen, you get like a low pressure area on the weather map, and that low pressure pulls back on this eardrum, and that stretches it and hurts. And the best example I have of this is if you dive underwater 8 to 10 feet in a pool, it will push back on that eardrum like that, and that will cause that same kind of pain. Sometimes this can go on for kind of weeks or months, and your child will complain of a dull aching, in their ear. Sometimes it's more of like a fullness where you sounds like you have water in your ear because your eardrum doesn't flutter as well as it normally would. And so they may say that it sort of feels like they're down at the bottom of a well, or it sounds like they have water in their ear. And that's called serous. Serous means watery fluid, so that's serous otitis media. And that can also cause you to have some pain. The third thing is called aerodynia, and it's like an acute episode of this where if you're in an airplane, when you go up in the airplane, you go from higher pressure to the lower pressure up in the atmosphere, and that makes things expand. So the air that was in here pushes its way out. And so most people don't have any pain when the plane is going up. When the plane starts to come down and we come from a low pressure to the higher pressure near the surface, that's when air has to get back in. And it's much harder to get air back in. It's kind of like if you blow up a balloon, it's easy to get the air out. It's a little hard to get it back in. So frequently when the plane comes down, air can't get back in here, and that will make this sort of a low pressure area where it pulls back on the eardrum. And you'll get that feeling like if you're 8 to 10 feet underwater, and you'll have that chronic pain that may last for sometimes up to 24 to 48 hours after you're back on the ground. You can sometimes call your doctor and get some numbing drops to just numb up your eardrum, and it'll help with that. This is why with babies, when plane is coming down, we're going to want them to maybe drink a bottle or suck on something so that they'll swallow more and pop their ears. If you're an adult, if you know how to hold your nose and blow through your nose to make your ears pop while the plane is coming down. Sometimes if you can do that before it gets bad, you can keep it from getting bad. So that might help. The fourth thing that I would mention is sometimes we get some crusting behind, right in that little crevice behind the ear, and it can look all weepy and infected. Actually, that's really not infection 98% of the time. That is almost always a form of seborrhea. Another version of seborrhea is cradle cap in children. It's just an irritated form of eczema that is common in that crack behind the ear. And even though it looks weepy and infected, it almost never is. It's seborrhea. If you put a steroid cream on it, it'll make it go away in a couple of days. The other crusting thing we see with ears, it frequently looks like an infection and it's not, is I'll see a lot of pierced ears where the earring and the post look really crusted and red and inflamed and infected. Usually that also does not require antibiotics. That usually is a form of contact dermatitis. Frequently less expensive earrings or have a metal in them that will have some nickel added to the metal. Nickel is a common metal that is mixed with other metals to make most inexpensive metals. And that many people is probably in the top 5 of things that people are sensitive to. Number 1, probably been poison ivy, nickel somewhere in there. In any event, what you need to do, you'll have an ear that's red, crusted, and inflamed. You'll need to remove that earring, get one that's either has a post made of surgical steel or sometimes a higher percentage of gold, and then put this steroid on that, and it should clear it up in a couple of days. So those are probably the 5 most common causes of ear pain when it's not otitis media or routine ear infection. So I hope that helps you out a little bit.